Hello, everyone. Welcome back to another episode of Coach Krisler's Convos. If you are new here, this is a place where we have conversations with people who have used functional medicine in their health journey. And people have had all kinds of issues, young people, older people, a variety of professionals, moms, you name it. And so we love to talk to them here. Today, I am joined by Kimberly. How are you today?
Good, thank you. How are you?
I'm doing well. Thank you so much for being on this show and being willing to share your story. So, before we get started with that, tell everybody who you are, where you're from, and what you do.
Hi, I'm Kimberly Salzman. I'm from the Chicago area, and I recently ended my career as a high school math teacher to become a health coach full-time.
Awesome. I've had several teachers on the show, and so I'm really interested to hear about your experience and, of course, to hear about your health journey in functional medicine. So, I guess tell me first, what made you decide on health coaching?
Well, honestly, that goes along with my health journey. So that health coaching became a way for me to help people walk their personal path to wellness,
Mhm.
because I feel that when you're going through something, or even if you just want to make changes, it can be really hard in today's society where you feel like you are alone. And
Mhm.
to have someone be your partner and walk with you and just hold a safe, not judgment-free space where you can be listened to and help, like even like think out loud to just figure out like what is best for you and what's going to work for you. I feel like we're in a society where we're just told what to do, or we're getting messages, this is best, this is best. And that is not necessarily best for you. So to figure out, what would work the best in your life, what is doable for you during this time in your life. So that's really where I came in,
Yeah, that's
wanting to be a health
awesome.
coach. Yeah.
Yeah, that's fantastic. It's so funny when you said, even just thinking out loud, it made me think about a client. I was talking with her one time and I was asking her about a meal service that she was having delivered. And she was thinking about not continuing it. And so I asked her, I said, so, where are you on that? Have you made a decision? And so she started talking, yeah, I think I'm going to cancel it. And then she kept talking and kept talking. And by the end of the time, I just let her talk. And by the end, she said, I think I am going to continue it. And here's why. And she gave me like 3 reasons why. And I didn't even have to do or say anything. I just gave her the space to kind of process it and think through what were the pros and cons of it. And that was it. So you are absolutely right. Right. When people have that space, when they can think through, ask questions, they can come to their own conclusions. They don't have to be fed the answers all the time. So yeah, so cool. So I want to hear about your health journey and really what brought you to functional medicine. So how, first of all, just tell me how you found a functional medicine doctor.
Well, it's funny. So I had gone to some conventional, I mean, your regular doctor, right? You're going for your physical, you're doing those different things. And this goes back, I want to say it was like 2016, 2017. I wasn't feeling that great. I wasn't very motivated. Looking back, I may have even like been mildly depressed where I was at. Couldn't lose weight, just not feeling right, just wanting the comfort foods, comfort, like your comfort coffee. Like, I just
Mhm.
remember talking to the doctor about that. And she's like, oh, you're fine. Like, you've already told me, like, you know how to like, just, work out, exercise more, eat less, and, you'll be fine. And I walked out of there like, wait a minute, what? Like, and I felt very alone. I can tell
Mhm.
you, like, I don't know if it was dark and cloudy that day, but that's how I remember the day. And it was in November. So very possible to be dark and cloudy in Chicago, but it's just how I remember the day. And like, then I had some tingling in my fingers, and so I had gone back to her to try to figure out some of those things. And she was like, oh, go see somebody for your neck. And like, it just seemed to go down this, there was no focus. There was no like prioritizing of me. It was like, well, I'm not really sure. Like she did put me on something. I don't even remember what it was at this point. And I went to see somebody, my neck was fine. So then I started trying to figure out like, okay, chiropractor, again, like nothing seemed to go that way. And this chiropractor was, I would say, more conventionally minded. He was not functional. And so, I guess, again, like what I was dealing with, like, it was not something that many people do deal with in conventional medicine. Cause, so it's Lyme disease, and the CDC does not recognize it as chronic. So depending on how you approach it, right, like people aren't even recognizing it, even though I am in the Midwest and it is, it's prevalent everywhere, but like if there were a place for somebody to talk about it, would be here, right?
So how did you even find out you had Lyme disease?
So that's where it was an interesting journey. So January of 2018, I decided this was going to be the year of Kim. And I told my husband, I got to figure this out. My gut was a wreck. And so I did find a functional doctor who decided I had SIBO, and like, yes, like all symptoms presented that way. No question. And so she put me on like, low FODMAP diet, like all these different things. We realized I was extremely malnourished, really, like nutrient deficient. And even though I was eating all the right things, and so that was an interesting, so that was January of 2018. July of 2018, I had already been on these diets, gone off. Then as soon as I went off of them, I didn't feel well. I had gone to Hawaii and my vitamin D level hadn't gone up. And it was just very interesting, right? So then one of my good friends, she called me over, I call it the intervention. And she was like, she's like, I think you have mold toxicity. And she's like, you need to go and up to this place in Chicago at the time. And she was like, I really think you have this, because they had it. And so a lot of the symptoms she felt like were that direction. And when I went to them, and I had reactions to mold too. But it was, so I went to them, they test my inflammation level, and they were like, you're not coming in at mold, you're coming in at Lyme. And then we did more tests on Lyme. And then obviously I came back CDC positive with Lyme. And then this last October, we finally just, like, there's a lot of in between there, but, and also several doctors. I've actually changed doctors. And this last October, we determined also that I did have mold toxicity. So I feel like a few key things from my story that I'd really love people to take away with is like, I feel like on Lyme, on social media or any of those things, you see such extreme cases. And so people are like, I don't have Lyme, right? I never saw a tick bite. We think I was 4 actually, when I was bit, based off of, discussion with my mom. And like at the time they thought it was a spider bite. So we're going 1979, like Lyme disease wasn't even a name, like there didn't even exist. But now looking back, and like I had a mycoplasma infection as well, that I did know that I had at that time. My mom, I did know that around age 6. So I was 4 probably when I was bit, and then around 6 or so, I was exposed. They did a test, and they found out that I have mycoplasma. That can be a co-infection of Lyme, which is why we're kind of putting those together. But so like the message, I guess, is that like my symptoms were very, like they're not extreme. But they're enough to do damage and cause inflammation, and long-term would really not serve me well, right, down the road. So unless you start looking into all of this and have that test, like you're not necessarily going to know. And like you can try to lose weight till you're blue in the face and you won't necessarily. Like I'm one of those bodies that hangs on, right? Versus some people that lose. And it's important to get to the root of the matter.
Yeah.
I went back to that doctor that diagnosed me with SIBO and all of that. And she was extremely honest with me. I was said, I'd like to continue working with you. I've been diagnosed with Lyme disease. And she's looked at me and she's like, I don't know anything about it. And so she was very honest with me. And then, so then I went back to that place and then since have left that place and followed a doctor who had left, who is amazing. I don't know if I'm allowed to share those things on here, but
yeah, of course.
Yeah.
So, I really, there's so many things in your story that I want to highlight. And one of them I would say just in general is the willingness to stay the course and to advocate for yourself is so necessary. You all obviously have gone through a multitude of different stages in what's been going on with you and finding out different diagnoses and trying different things. And so sometimes it can be very daunting, it can be very exhausting, to kind of search for those answers. But I encourage those of you out there who are watching and listening, stay the course and advocate for yourself, because in all of the stories that I have done and all the conversations that I have done, that is definitely something that everybody has done. We've all kind of hit a wall and been like, I don't know what to do, but somehow, some way, somebody's come into our life. We've asked another question. We've read another book. We've listened to another podcast. We've seen another doctor, whatever it was, we kept going. So I just want to encourage you guys to continue stay the course.
May I say one thing with that?
Yeah, go ahead.
Along that theme is like with my diagnosis of mold this past October, which I have cleared, by the way. So that's, this isn't like something that you stick with, like you can clear it and like, then just be on maintenance. But it was along those lines where it was a collaboration with the doctor and we talked about it. And I was like, could this be because my Lyme was I just can't get it to be completely asleep. That's kind of how I look at it. And my daughter had tested positive, like different people had tested positive in my life. And I'm like, is this possible? And she's like, your inflammation isn't as high for that, but she's like, let's just give it a try. And as a result, like I did test very positive for it. So, so that's been a big linchpin and hopefully it's going to help go forward. So,
yeah. Something else that resonated is that you knew something was wrong. You might not have known what it was or what it was called, but you knew something was wrong. And I think sometimes when we go for help and when we say, okay, something's not right, and we have symptoms that seem very normal, we're tired, well, you're a working mom, or, I'm tired, well, you have an infant, or, whatever it is, right? It kind of gets normalized and it'll be like, it'll be okay in a couple of weeks or, whatever. But again, if you know within your heart of hearts, you're like, this doesn't feel right. I'm not supposed to have headaches all the time. I'm not supposed to have this pain all the time. That's also something I would encourage people to stick with, because clearly you did that, right? You were told, not that big of a deal, but you're like, yes, it is. Something ain't right here. Help me. So I think that's also something that's really important, is to have that self-awareness and to kind of stick your ground and draw a line in the sand and say, nope, we're gonna figure this out.
And I feel like, and this is something I did right until 2018, where, so I was 43, I was 42 technically, I guess. And you just put your head down and you just deal with stuff. And
Mhm.
as busy moms, especially, I feel like you just put your head down and you just like you go through it and like, oh, I don't feel that good right now, but it's okay, it'll pass. And you just don't take that time for yourself.
Mhm.
So many people I've talked to, when they found out that I was being a health coach, they're like, oh, that would be so great. I just don't have the time. And
Mm.
but there are these people that need it just to be able to focus on themselves. And I feel like
Mhm.
we as a society don't allow ourselves to use self-care and like really pay attention to ourselves until you get to this point, like where I was at, where
Right.
it's like I couldn't take it anymore.
Right.
Um,
Yeah. Your bucket had been filled and filled and filled and filled and filled, and now it was overflowing, and your body was just done. So something else I think is interesting that you mentioned is there was intentionality in looking back at your life. You
mhm,
mentioned, kind of going back to what it was like for you as a kid, and maybe possibly there was something happening there and these other issues as a small child.
mhm.
And again, conventional medicine doesn't necessarily do that. It looks at what's happening today, maybe going back a couple of weeks or maybe a couple of months of symptoms. But in functional medicine, your entire life is examined from birth or even before so up to today. So it's really cool to hear that, that happened with you as well.
Yes, it was a very interesting experience to go in there. And I think people at first, when they hear about functional medicine and they're like, oh, it's expensive, or like they call and that first appointment is expensive. They don't like to, and then the subsequent ones obviously are not as much. And that first appointment though is it's gold. I mean, I don't know how else, I mean, the amount of time that the doctor, there is never a time in your life that you've been listened to by a doctor like that ever, or
Hmm.
practitioner. So obviously some of them aren't MDs, but and like just the amount of information taking and connecting the dots, and then you leave and then you end up, if you have the ability and the privilege to be able to talk to your mom, that you're able to call doctor and be like, hey, do you remember anything else? And now you're messaging back the practitioner, right? Like
Hmm.
oh,
Hmm.
this also added to it, and they're like, what? Like I didn't realize, so that summer I had been bit. um the doctor, I mean, my pediatrician told my mom to spray my bed with off that whole summer. So like I slept,
Wow.
yeah. So again, like they didn't know any better, but like I had such a bad reaction. There was such concern
Hmm. Hmm.
that we got to prevent that reaction.
Yeah.
So,
And that was what they knew to do at the time.
right.
So, you can't really blame that
No,
doctor because that's all they knew. But now having that information and being able to share that with your practitioner today, that adds another layer to your story.
yes, I mean, all during high school when I was under stressful times, I would call my mom. There would be times I'd call my mom and be like on the payphone, because we didn't have the cell phones. And I'd be calling my mom and saying like, mom, I just don't feel good. Like, I just can't really sit still. I don't
Mhm.
know. Like, and she would be like, no, again, no one knew anything. So no blame. She'd be like, do you have a fever? No. Are you going to are you sick? Are you going to throw up? No. Like, okay, well, like and but looking back now, that was totally the line, because like, you're
Mhm.
not feeling good, you're under stress, you probably didn't sleep that well. So now that next day you're off, your body hurts, but you don't really know what to say. And so things like that, where if your kid is saying those types of things to you, maybe that is something,
Mhm.
to look into.
Yeah, and it's worth investigating.
Right. Exactly.
Yeah. Yeah. So, tell me a little bit about how this affected you as an educator. What was this like for you on a daily basis with your teaching?
My journey, my health journey, you're saying, or
Yes, going through all of this and now still teaching, still working, going into the classroom, preparing lessons. What was that like?
well, for me, it was very interesting because I'm not saying like just from I'm not saying it was harder. It was just
Mhm.
interesting because I had actually been gone from teaching for 13 and a half years. And this was my first year back in my own classroom. So I was just started back, and I think I got diagnosed in like September. So it was a
Great
lot.
timing.
Right. Fortunately, at the time I was part-time. So I was able to I did have a little bit more, flexibility in my schedule. It was hard. There's no question about it. It was still hard. Like, it got easier, but it was very challenging just because I didn't feel well a lot of the days. You need to find that patience for the kids, and it's not their fault. I taught high school seniors. I was honest with them about what I was going through, so that if I did have an off day, I gave them a heads up, and that trust that I had built, the trust and rapport that I had built, helped me with that. Because I would just be like, today is just not a good day, going through metal detox during all of that, having I had the fillings taken out of my teeth and replaced. And then you had to go through a heavy metal detox. That was really rough. And I had a very supportive school too. I had gone to them right away, and told them what was going on, so that if they saw a bunch of medical appointments coming through, that they would know. And my boss, my direct boss, and my division head, my principal, were amazing. So I was fortunate to have that. I know not everybody has that. And honestly, my fellow teachers too, I had told a couple people, and they were right there with me and helped me out. But I did it. I went every day. I didn't you just make it work. But it is hard. And some days it's really hard to concentrate and have the energy. I found, especially initially, I did have a harder time remembering names. I don't know if that was a stress or the Lyme or what, but it was kind of interesting. I could tell it was taking me longer. But again, I was honest with the kids, and they can be really great when you're honest with them.
Yeah,
right.
Absolutely.
When you treat them that way, they'll treat you back that way. And
absolutely. I think sometimes we don't give young people enough credit, and allow for them to really show what they are capable of. Yeah, I've had those moments too. In 20 years of education, I've had plenty of those opportunities. And even just last year, right before a class, actually, this is why you don't check your phone in the middle of the day. I got bad news, from 3 different directions, and I just couldn't hold it in. And I told my students, look, we can't have class today. And it was through a bunch of tears and a crackly voice. But I said, I will see you next class, be ready to go, and, give me a little bit of time, and it was fine. So, that honesty component is so important. They need to know you're a real person.
right.
Because then they can be real people as well. They have issues that they're dealing with, just as much as we do. So yeah, really cool to have that experience and to have that kind of support as well.
Yes. But at the same, it's interesting though, because my husband, my kids, everybody, they're very supportive. But bringing it back to the health coaching piece, I still, though, at times felt very alone. And even though they're right there supporting me, because they're not doing it, they're not going through what I'm going through. So that was another piece of my drive to be a health coach. Because at least I may not have gone through the same thing as the person that's sitting there, but I have gone through something. And so that I could be there for that person at that.
Yeah. So I'm interested in finding out about some of the lifestyle changes that you made that you found beneficial for you. So where did you even start with lifestyle? What did you adjust first?
I would say, I think so where I went first for Lyme, they actually had a Lyme Academy, is what they called it. And it was just like one day. You went for an hour-long presentation. And then they took a ton of blood. So it was like this whole, like, and then they gave you your paperwork and you had your next session scheduled. So that very first time it was like, okay, here's your plan. This is what has to happen. Like over the next 2 weeks, you can't eat any of these things, but then in 2 weeks, then, excuse me, you can add back in, XYZ. So, those first, I forget what it was, maybe it was 4 weeks. It was very, very, very strict, like down to like, you couldn't have chicken. Like you had to, like, it was no grains, any of those, types of things. It was very, very strict. So then after that, though, the things that hung on, were like no dairy, no gluten. As far as food is concerned, trying to think if there was anything else. Like it was like, oh yeah, limit like alcohol, like limit that type of thing. But there wasn't huge talk about that at that point. There wasn't, I think maybe for those 4 weeks, there was talk, but like beyond that, there wasn't that much talk. And like sleep was very important. Really a big thing that was big for me was just learning to share how I was feeling at home. I didn't do that before. Like I would just, shut my mouth and just go with it. But then it became, no, you need to tell me when you're not feeling well. And like, if you need a bath, take a bath. Like, so like the Epsom salt baths were huge, still are. Those types of things though, starting to just communicate with the people around you, was huge because they had no idea. Like I was not feeling well right now, but this is the way I've been feeling. This isn't out of nowhere. I just never.
Right. How do you think, how did it feel to start expressing yourself in that way?
It felt weird at first, but then it got like a complainer. And then it became like, no, like this is what needs to happen. Like in the house. And so I felt you allow yourself to feel more supported because you're actually, telling them when you need to be supported.
Yeah.
I mean, it became like, there was just no question. If I needed to go to bed at 8 o'clock, I went to bed at 8 o'clock. Now again, my kids are older. So that on that end, like they're teenagers, now. So, but so they were what? They were middle school, still, but very self-sufficient, right? Versus like somebody who has little kids. I can see where that would be a lot harder to do. Like, but for me, I didn't have that. So, but yes, I went to bed a lot at like, I'd be falling asleep on the couch at 7:30 at night. So I'd go up to bed at 8 o'clock. And I was very sad because I'd hear about everything that they were doing after I went to bed. Like, because that is a key pivotal time where the kids are actually home, right? From like, and they're up from like 8 to 9:30 and they're hanging out watching shows together or something, and I'm not in it. And so that was sad. But I was like, there is a reason why we're doing this though. So.
Yeah. So interesting. So in terms of, so you mentioned nutrition,
Oh yeah,
the things that you had to do nutritionally to kind of eliminate and then potentially reintroduce. And you said gluten and dairy are out wholeheartedly, correct? If I heard you
yes,
correctly.
and I will say, so along those lines, then, and this isn't meant to scare people away from from functional medicine, but because like my mom will look at me and she's like, oh my gosh, I couldn't do that. I'm a very regimented person. So when you hear what I'm saying, like I am just one of those people. I'm very self-regulation is top
I
on
was
my.
going to say that you're a big character strength of yours.
It's huge. And so what I'm saying is I'm not saying this that somebody else like is going to sign up to do this. And so like that's where my functional practitioner was hesitant. But then when again things were just not moving the needle, and she was like, I really think you need to cut out sugar completely. Like
Mhm.
cut it out. Like for 6 months. She's like, no sugar, no alcohol, like cut it out. And like so that was January 2021, no, 2022. And for probably like 6 to 8 months, I didn't have any sugar that wasn't fruit, and
Mhm.
fruit was eaten on a very limited basis.
Mhm.
But yeah, that's vacations without ice cream, going with the family to the local ice cream shop and not getting anything, all of those things that
Mhm.
I know is very hard, and I'm not minimizing it, but I just kept thinking like, no, I'm not going to do it. And then when I got diagnosed with mold in October, knowing my personality, she was like, here's my recommendation for food for mold.
Mhm.
So that was a whole different thing of more things that you shouldn't eat. Um,
Mhm.
and even along those lines too is, limiting your certain carbs. So having like the low starchy vegetables, so broccoli, cauliflower, those types of things for people that don't like, but cabbage, Brussels sprouts, like any of those types of things that are low in like low carb. So
Mhm.
that was a lot of that, and no potatoes. There's like, and limiting sweet potatoes, like that kind of a thing. Um,
Mhm.
no grains. Um, so then I did that for another 3 or 4 months. I have a portable infrared sauna that I have in my basement, bought it on Amazon. So I was doing that, dry brushing, um, and then Epsom salt baths and
Mhm.
walking.
Yeah.
Walking, and people don't respect walking for all it can do for you. And it's a huge tool for exercising,
Mhm.
moving your body, detoxing your body, like all of that. So
Yeah.
that was a big part of the functional medicine prescription as well. So.
Yeah. Walking is amazing. It is such a helpful tool in your toolbox. And, for even people who struggle with pain and things like that, even starting just with 5 minutes,
Mhm.
you don't have to jump in the deep end of the pool. Wade in the shallow end for some time until you're able to do it. And then, gradually move out into the deeper parts of the pool. So, yeah, I love that you talked about how your personality matched what you did.
Mhm.
You were able to jump kind of deeper into the pool, but you also were more so in a position of this is not changing, right? You were at a point where your symptoms were so difficult to manage, and there were so many things that you had already gone through. And so sometimes when you're at that point, you're ready to jump in the deep end. But if you're not ready, what can you do? What's
Exactly.
one thing can you do? Right? What's one thing you can opt into or change or take out of your diet or whatever it is?
And I think that's important too for the person, like if they don't have a health coach, when they're talking to their doctor, if their doctor looks at them and says, there's no sugar and I want you to cut out coffee and I want you to do, um, these different things. Like when I went to that Lyme Academy, a woman was so distraught on the fact that she couldn't put dairy in her coffee.
Mm.
It was this, like, she kept saying it. Um, and the way that event was structured, there weren't alternatives.
Mhm.
Talk to you about that. And like, instead she was pretty much shut down. And
Mm.
so here that woman probably walked out of there going, I can't do this. Right. Whereas like, if like to be able to be met where you're at, I think is key. And I think when you're talking to your doctor, your practitioner, if I would have looked at her and been like, no, I can't do that, she would have been like, okay, I know somebody who's seen her that's like, I know what Kim's done, there's no way. And she's like, we're not going to ask you to do what Kim did. Like,
Right.
we're going to ask you, what can you do? And that's the key part.
Yeah. Yeah. So, so important. that you remember this is a personalized approach. It's about the individual. It's not about a universal standard of care. And so that's one of the really cool things about functional medicine, of the many cool things, but that definitely is one of the cool things. So absolutely. I'm curious how you even found your functional medicine practitioner. Was it through a friend or family member? Did you find them online? Like, how did you even find somebody to work with?
I was trying to think about that with the very, very first one. I think I did, maybe I Googled like holistic approach or something like that. And she popped up and she was in a good location for me to get to. That's why I went to her. And at the time she was taking insurance. Now she is not. And then the next place I went to was because of my friend. She told me to go there, and her journey, they had gone down that mold path. And she was just Googling like mold, like, and what can happen with mold, I think. And then like that kind of led her, like this place popped up. So that's where, and they also took insurance. So that was huge. And then this person I'm currently with was at that place and opened her own practice. And initially, I'll be honest, I was like, I'll go there for a couple times. My husband was like, I think you need to go a couple times. I know it's not covered, but you've been working with her and you've been getting success. So like, so now to break this again, like, what are we going to do? So I went, so I followed her to her spot. And I've been with her ever since. I'll be honest, like I can't leave her. I mean, and she's actually the one who told me about the Functional Medicine Coaching Academy. I asked her, I'm like, I want to do this, but who should I'm like, I went online and she was like, I think you should look into Functional Medicine Coaching Academy. So she had gone through IFM and then, so I did, and I talked with the rest is history. I talked to the people there and decided I want to go with that program. But yes, I'm still there. I've gotten a lot of people to go there because it's a special place, like finding a functional medicine place. I'm not saying all of them are like this. So you got to find the one that fits you and does this. Like, you should feel loved when you walk in, like, and if you don't, you should leave. Like, and that, because that's the point, is that they want to care they should be caring about you as a whole person. That's why you're going there. And just be an advocate for them yourself and talk with them and be honest. Don't be embarrassed about anything. And it's just it's really an amazing experience and journey. To know you have control, like, of yourself. Like, unlike everything that's you're hearing out there, you actually do have control over your life, and not something that you're just destined to be dealing with things. So
it's very empowering, and it gives you hope that progress can be made and improvements can come.
Exactly.
Yeah.
And even for longevity, even if you don't believe you have anything pressing, I tell everybody now, go and just get your blood work done. That's it. That's 2 appointments. You're going to go and get your initial, get your blood work done, meet with them after it. And then you never have to go back ever again. That's what I tell everybody. I'm like, you just get those eyes on your blood work, like unlike anybody else's eyes. Like, I'm like, the way they look at things is
and the amount of blood work that they do, the amount of tests that they do on your blood, I should say, is going to be greater than what is done in conventional medicine. Sometimes the markers in conventional medicine might tell you something, but sometimes they're normal or they're within normal range as set by the guidelines. And yet it's not all the markers that could be tested on that particular issue or area, like your thyroid, for example. And so when all of the markers or multiple markers are looked at, now you're getting a little bit of a bigger picture, a fuller picture of what could be going on. And then you're like, oh, well, this is normal, but this ain't normal. So yeah, that's a great way to think about it, is just go get your blood work done. That's something that should be done at least once a year anyway.
Mhm.
So, why not get a full panel?
And that's where too, a good thing to ask when you call the functional medicine, like that doctor's office, is if their blood work and everything is covered. Like, so mine, yes, there are tests that are not covered by insurance, but they wouldn't be covered anywhere. But then a lot of my tests are covered. And so it'll be $9,000 in blood work and the bill is $19. So, depending on the practitioner, they do negotiate with labs. So you can ask that question too.
Yeah, absolutely. That's a great point. I've seen 2 different functional medicine doctors, and one is a family medicine practitioner and the other one is a gynecologist, and they do their labs differently. One has a nurse who draws in-house, the other one sends you to a lab, but both of them know it can be costly. And so they provide as many labs as they think are needed. And then they have a lower cost. And the lady that sends me to a lab to have mine drawn, that doctor, she sends me to a certain lab because she knows labs charge different prices for the same exact thing. And so she's like, nope, go to this one because you're going to pay way less than at the others. And I never really found that with conventional medicine.
Right.
But because functional medicine does operate differently in many ways, and they know people are paying out of pocket and so forth, they're looking for the deals. They're looking for the caveats in the system.
Yep.
Yeah.
They're also very honest with you too, and a little bit like, test is going to cost this much money. So, that I appreciate that openness too.
Yeah. Well, I appreciate so much you sharing your story and giving us all these tips, because these are helpful things as well that people need to know going forward. So if people want to connect with you, follow you, ask questions, where can they find you?
So I am it's on Instagram at Personal Path Wellness Coaching. And then my email is Kim Salzman, and that's with 2 N's, hc@gmail.com. And you can also find me on Facebook with Personal Path Health and Wellness Coaching. My website is not up yet, but you can put your name in there at personalpathwellness.com. I am open to working with anyone. I am focusing on on helping women with PCOS reduce the severity of their symptoms, because so that is really a syndrome that you can reverse, and then prevent, like having a hysterectomy, and potentially prevent a hysterectomy or infertility and all of those things. And it's something that doctors are not talking to their patients about, as far as like it being a lifestyle driven disease or syndrome. So that's where I'm focusing my efforts.
Awesome. Well, good to know. I will definitely put that information in the description of the episode. Again, thank you so much for your time and for sharing your story. And thank you to everyone who is watching or has listened to this episode. I appreciate you. Don't forget to hit the subscribe button so that you can catch all the combos, and drop us a comment. Let us know what you thought about this episode. And I'll see you next time. Bye.
Bye.